So today we're talking about how the media has pounced on Donald Trump because he said he downplayed the coronavirus. Actually, Woodard said that, and Trump admits it. Now, part of the problem is the media blows everything out of proportion so that Democrats can have an advantage. And then the Democratic plan for coronavirus was not to work together for the good of the American people, it was to undermine President Trump for political advantage. So, was Trump right or was he wrong? If Trump did not downplay COVID, they would have said he was intentionally causing panic. In my opinion, this has been a 4-year-long attempted coup against a sitting president, and both the media and those Democrats that were seriously complicit in undermining our country should be tried for treason. More to come.
The Doctor of Disaster is a wholly owned subsidiary of Warnick and Associates Incorporated. Don't forget to get your copy of the Doctor of Disasters book, Emergency Incident Management Systems, at Amazon.com. This book is the go-to on managing disasters and on the Instant Command System.
I'd like to remind you to like, subscribe, and comment. This helps me with the YouTube algorithm, and quite frankly, this information needs to get out. Hello, everyone. I am the Doctor of Disaster. I am considered a subject matter expert in public safety and public health emergency management by not one, but 2 different universities. Today, we're talking about President Trump downplaying COVID-19. And this actually goes back to the February 26th press conference that he held. So, as I go through this, I'm going to explain emergency management principles and public health emergency management principles so you can see why he did so. Additionally, I'm going to show excerpts from that press conference where you can see exactly what he's doing if you look at it through a lens of trying to keep calm among the American public. Now, in emergency management, we see a whole host of emotions. And our job partially is to control those emotions so that people don't destroy themselves or their own plans. Now, emotions are a threat to public safety. They really are. In order, these are the emotions that most people feel during a time of crisis. First and foremost is apathy. They could care less. Then the next level is concern. Concern is where they understand that there's a risk, but they aren't over the top about it. The third is fear. While fear is normally bad, having a healthy fear of something is good. The next is terror, and terror is really tough on the general public. It can cause people to do irrational things. Then there is panic. Now, panic is really bad because when you panic, you do things that are not common sense, that go against everything that you should be watching out for. And then there's denial. And denial is perhaps the worst. Now, in emergency management and public health emergency management, if people are too apathetic, we try to get them more concerned. Sometimes, not always, but sometimes by arousing fear, we get them to act where they'd just be apathetic. Other times, we try to push outrage so they aren't apathetic. If people are too frightened, we try to diminish their concerns or get them to be more apathetic. And sometimes we do that by diminishing their fears, and other times we do this by reducing their outrage. What you do in public health emergency management is evaluate how concerned people are or that you think they'll likely become, or how concerned you want them to be. Now, this isn't a Jedi mind game where we're trying to have someone think the way we want them to think. What we're trying to do is reduce how devastating these emotions can be. Now, depending on what you want to do or what you're trying to accomplish, different organizations will pursue different risk strategies. When the topic is a bioterrorist attack or any health emergency, apathy probably isn't the goal that you want. While apathy is not the goal in the pre event phase, that's when you're talking about a possible future emergency. You want concern. In fact, you may even want a lot of concern or potentially fear. Why do you want to instill that? You want the public to be cautious, vigilant, willing to be inconvenienced, willing to pay for preparedness measure. And the other thing is you may want them to volunteer. Now, during an actual emergency, concern isn't enough. So, as we look at what President Trump was in at the time of that briefing, he was in the pre event or the pre pandemic. According to emergency management principles, he wanted people to be concerned, but not have a lot of concern or panic. Fear is an appropriate response in most instances. And it's okay to have a little bit of fear, but we can't let that fear overcome us. Fear turns into terror sometimes, and then it can also turn into panic. And panic, of course, just goes way too far. Panic prevention is crucial in emergency management, especially public health emergency management. Why? Well, what most people don't realize is panic is highly contagious and highly destructive. Now, there are instances where we want panic, but very rarely. You know, when we look at the February 26th um, press conference that President Trump did, he was trying to keep people calm. Now, if we look at that later on, a week later, there was a huge run on toilet paper. People panicked. And then, of course, you had the people that went out and bought entire truckloads of toilet paper, bleach, whatever they could get their hands on that they thought people would need to make money. This created more of a panic because there was shortages on the shelves at stores. So let's look at what President Trump actually said and what his actions were when it came to downplaying.
Thank you very much, Mr. President. The doctor at CDC just talked about dusting off preparedness plans, but coming from you, it has more weight. Do you feel that U.S. schools should be preparing for a coronavirus spreading?
I would think so, yes. I mean, I haven't spoken specifically about that with the various doctors, but I would think so, yes. I think every aspect of our society should be prepared. I don't think it's going to come to that, especially with the fact that we're going down, not up. We're going very substantially down, not up. But yeah, I think schools should be preparing and, get ready just in case. The words are just in case. We don't think we're going to be there. We don't think we're going to be anywhere close. And again, if you look at some countries, they are coming down. It's starting to go in the other direction. This will end. This will end. You look at flu season, I said 26,000 people. I'd never heard of a number like that. 26,000 people going up to 69,000 people, doctor, you told me before. 69,000 people die every year from 26 to 69, every year from the flu. Now think of that. It's incredible. So far, the results of all of this that everybody's reading about, and part of the thing is you want to keep it the way it is. You don't want to see panic because there's no reason to be panicked about. But when I mentioned the flu, I said, actually, I asked the various doctors, I said, is this just like flu? Because people die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. But we have it so well under control. I mean, we really have done a very good job. Go ahead.
Isn't it interesting? He thought that every aspect of our society should be prepared. He thought schools should be prepared, businesses should be prepared, and everything else. Now, let's look at what happened when a member of the press tried to sensationalize COVID 19.
CDC said yesterday that they believe it's inevitable that the virus will spread in the United States, and it's not a question of if, but when. Do you agree with that assessment?
Well, I don't think it's inevitable. It probably will. It possibly will. It could be at a very small level, or it could be at a larger level. Whatever happens, we're totally prepared. We have the best people in the world. You see that from the study. We have the best prepared people, the best people in the world. Congress is willing to give us much more than we're even asking for. That's nice for a change. But we are totally ready, willing, and able. It's a term that we use. It's ready, willing, and able. We have. It's going to be very well under control. Now, it may get bigger. It may get a little bigger. It may not get bigger at all. We'll see what happens. But regardless of what happens, we're totally prepared. Please.
Notice how he diverted and downplayed it. Why? Because he did not want to cause panic. He didn't want the runs on the stores. He didn't want people going out to make a quick buck, to price gouge those people that didn't foresee the future. If you also look at what he says, let's see what he says about the plans.
Yeah, please.
Mr. President, have you been presented any plans that would involve quarantining cities like we saw in China, and what would have to happen for you to take a
We
step
do
like
have
that?
plans of on a much larger scale, should we need that. We're working with states. We're working with virtually every state. And we do have plans on a larger scale if we need it. We don't think we're going to need it, but, you always have to be prepared. And, again, Congress is talking to us about funding, and We're getting far more than what we asked for, and I guess the best thing to do is take it. We'll take it.
How much money are you willing to give Congress if they're going $6 billion?
Well, we're going to see, but we'll take care of states because states are working very hard. We have hospitals in states that make rooms available, and they're building quarantine areas where you can keep people safely. We're working really well with states. It's a very big part of it. So, my attitude, if Congress wants to give us the money so easy, wasn't very easy for the wall, but we got that one done. If they want to give us the money, we'll take the money and we'll just do a good job with it. Yeah, please.
We plan for worst case scenarios should we need that. Does that sound like he's trying to downplay everything criminally? No, he's trying to keep calm. This is a basic principle of managing emergencies. If you're not in the field, you don't understand this. If you're in the field, you understand it unless you're so partisan that you won't admit the truth, which some people are. Now, of course, these journalists are always trying to get him with that gotcha moment. And a reporter actually says to him, "You're downplaying coronavirus. Are you telling Americans they don't need to do anything to prepare?" Here's what he said.
Thank you, Mr. President. Tonight, you're minimizing the risk, the danger of the virus. Are you telling the Americans, except for the ones who are sick, not to change any of their behaviors?
No, I think you have to always, I do it a lot anyway, as you probably heard. Wash your hands, stay clean. You don't have to necessarily grab every handrail unless you have to. You do certain things that you do when you have the flu. View this the same as the flu. When somebody sneezes, I try and bail out as much as possible with the sneezing. I had a man come up to me a week ago. I hadn't seen him in a long time, and I said, "How you doing?" He said, "Fine, fine." He hugs me, kisses. I said, "Are you well?" He says, "No." He said, "I have the worst fever and the worst flu," and he's hugging and kissing me. So I said, "Excuse me." I went there, I started washing my hands. So you have to do that. This is, I really think, Doctor, you want to treat this like you treat the flu, right? And, it's going to be.
And he also admitted that it might get worse. So, what's the problem here? He did crisis management according to what many books, many professors, many emergency managers are told to do. After a reporter's question, he also talks about the divisiveness of Pelosi, and Trump slips up and says, "We have a big problem." And then he says how Nancy Pelosi should work together with the administration for the betterment of Americans. Later in the press conference, he's asked about Chuck Schumer. Now, here's the ironic part. It's at this time that many, many, many Democrats, not all of them, many, were actually saying coronavirus was nothing. So were they downplaying it? Were they pandering? Were they trying to undermine the president? When we take a holistic look at everything, we see that it's a no-win situation for President Trump.
No time for Donald Trump's record of hysterical xenophobia.
If you had to, would you close down the borders?
No.
Come to Chinatown. Here we are. We're, again, careful, safe, and come join us.
There's very little threat here. This disease, even if you were to get it, basically acts like a common cold or flu. This should not stop you from going about your life, should not stop you from going to Chinatown and going out to eat. I'm going to do that today myself. And transmission is not that easy. I think there's been a misperception that coronavirus hangs in the air waiting to catch you. No, it takes direct person-to-person contact.
Now, I'm going to preface all this with my latest research. I have literally been looking at everything that was done in the first 60 days of COVID-19. I am probably a week or two away from releasing what was done right and what was done wrong. It's not biased. I just took all of the information, entered it into a data sheet, and I am now sorting that data. So, stay tuned for that in the near future. Finally, and I'm just going to put another clip in here so it's easier on me, but don't forget to like, subscribe, share, and tell others. Until next time, be safe and God bless. I'd like to remind you to like, subscribe, and comment. This helps me with the YouTube algorithm, and quite frankly, this information needs to get out.
The Doctor of Disaster is a wholly owned subsidiary of Warnick and Associates Incorporated.